Welcome to Dimensional Wellness 365, where today I want to talk about how I got slammed with COVID, but also health, like true health, metabolic health, prominent plant-based lifestyle health, the kind of health that you do not need a medical lifestyle, right? So you use conventional medicine combined with lifestyle medicine, right? Or lifestyle as a medicine. So let's start with COVID, and I don't want to focus on the COVID part of it, but I'm going to tie it into the health part of it. So I got slammed back in February with COVID. When I say slammed, I was a solid week. I was tired. Even though I tried to keep working and typing and that, I'd be like a 90-year-old drunk, waking up everywhere. I've even passed out, like literally passed out because of low oxygen with hot showers. So do not do hot showers when you have low oxygen. So that transpired in about a week time frame. Where what's interesting about it though is I'm 56 right now, and I've discussed it with people that in their 40s, some in their 20s, 30s, 40s, 50s, nobody much older than that, maybe some in the 60s, but some are double vaccinated, triple vaccinated. There was some that were down for 14 days, 10 days, 7 days, 3 days, different wild frame. But again, I'm 56 and some are in their 20s and they're double vaccinated plus, and they were tired, exhausted, etc. for 2, 3, 4, 5 days, and some of them up to 14 days. Well, and I tell individuals, I really, in the last 3 years, I've lived a prominently plant-based lifestyle, metabolically healthy. I trained every single day. I haven't missed a day. I've missed a day of fasting, missed a day of prominent plant-based lifestyle. Or do I have my desserts and my wines and this is very low sugar wines. That's how I live my lifestyle. But for the most part, in the last 3 years, I've been extremely healthy. And what I've noticed during the COVID outbreak for myself, even though, like I said, I am very healthy, it was the inflammatory markers. And I did 3 blood work since then, and all blood work showed the inflammatory markers, which is very interesting because everything that I had pre my Western lifestyle, my the arthritis in the knees, the calcified tendonitis in the hips, all the medication that disappeared, what I found during those 7 days, and let's bring it to 2 weeks where I was really tired. Like not tired like the first week, but the second week it was just taking me time to rebuild and get healthier again. So in that time frame, I was not training. I missed a good 7 days of training, but I kept my flexibility as much as I could and that kind of stuff. But so if I look at my last 3 years, I missed a good 7 days of training, which I do every day, like I mentioned a moment ago. But when I looked at the inflammatory markers, the pain in the knees came back, the pain in the hip came back, my knuckles, my hands, cold feet. The brain, like I still feel the brain part of it, like a vice in there or pressure of some kind, all inflammatory markers. So when you look at the 2.6 comorbidities out there, and they say that, and this is World Health Organization, these are government stats and government data that I'm going to talk about here. So if everybody listens to government stats and government data and World Health Organization, etc., when it comes to anything that we're told to do all the time, because we've just been through a hell of the last 2 years, unhealthy wise, when I'm talking about lethargicness, when I'm talking abuse of alcohol, abuse of processed foods, sitting on couches and just social media lifestyle, distancing themselves from families, distancing yourself from community. These are all principles of lifestyle as medicine, right? Engagement, community, fitness, etc. that was closed down. Churches are closed down. Community centers are closed down. All these things are unhealthy for you. So let's move that aside, and then we look at the 2.6 comorbidity. They're all tied to inflammatory markers. So the organization like World Health, and I will tell you that 94% of all death were related to people that had 2.6 comorbidities and above, etc. Again, that's your diabetes, that's your cardiovascular type diseases, inflammatory diseases. But let's move that aside. If you look at World Health Organization, for example, they have stated that 80% of all chronic illnesses are basically lifestyle born, right? So the way people live, the way we consume processed food, 60% of all foods are processed or ultra-processed, refined processed. So they're saying we would get rid of primarily up to 80% of all chronic diseases if people live the lifestyle changes, right? If they live a healthier lifestyle, prominently plant-based lifestyle, physical activity, exerting your social life, your love life, your community life, all that stuff. If you did that, chronic illnesses would dissipate or disappear up to 80%. Here's the other thing they say, up to 40% of cancers would disappear and dissipate, etc., if people live a more healthier lifestyle. Let's go further. Look at your hospital stays. Look at the people in beds. The people that preoccupy beds in the hospital, this is government data, research. Pull it up. They will give you all the time frames, the decades. They will give you all the illnesses, and they will give you the dates and the years and the ages up until 100 years old, etc., etc. Research those diseases, those illnesses, those conditions while they're in a hospital. You're going to look at 2/3 of people that are in hospitals, preoccupied in hospital beds, are tied to unhealthy lifestyles. It's all inflammatory related illnesses and chronic conditions. The 30% is primarily the ill-disposed or the people in car accidents and so forth. Those are unfortunate through life with bad genes and etc., right? But the prominent people in hospital beds are tied to inflammatory conditions, chronic pains, etc., that if you were to do lifestyle changes, our hospitals would be for those that are the predisposed with medical conditions or car accidents and so forth, right? Our hospital system would just come down to a nice pace. Right? The world wouldn't depend on medication. The world wouldn't depend on surgeries. The world wouldn't depend on basically the unhealthiness of lifestyle. They say that the number one causation of obesity is marketing. So why don't we stop unhealthy marketing? Like for the last 2 years, we've stopped the world. We've told everybody what to do, what not to do, what to say, what not to say, all that stuff, right? But if we can do all that and we can control everybody, like just because there's no string doesn't mean you're not a puppet, right? So for the last 2 years, we were able to do all that. Why can't we make unhealthy marketing illegal? Why can't we enforce education from the onset in schools when we're talking about prominent plant-based lifestyles, talking about exerting energy every single day, talking about community associations and so forth, right? It takes a village to raise a child. Why don't we teach all those kind of things in school, right? From the onset. Why don't we enforce healthiness? Why don't we simply enforce healthiness? Is it because it's tied to money? Is it because it's tied to medication? Is it because they say there's no money to be made? There's money to be made just by different entities, not by the ones that are holding the harnesses right now. That's why. That's my why, right? That's why I look at it. So when I look at COVID and I look at the 94% and the 80% and the 40% and the 2/3 that I talked about, when I look at all those reasons why people should get healthier, right? Instead of always going down that path of conventional medicine, we can get all on a path of lifestyle as medicine. Proven, data, research, etc. I'm living proof. And there's a whole shitload of individuals out there that are living proof. I follow groups in their 50s, 60s, 70s, and 80s, and they are healthy. And they live lifestyles like this. Right? I have my desserts. I feast at dinner. I drink my wines. But it's when I drink my water. It's when I exercise. It's when I drink my wine. It's when I have my desserts and how I have them, what type of desserts that I have, and what type of wines that I have. So you can live a really, I call it fasting, fitness, flexibility, Mediterranean lifestyle. And I have not fluctuated more than 10 pounds. I'm going to say about 10 pounds. When I got sick with COVID, it was about 15. But I averaged 10 pounds fluctuation in 3 years. I used to fluctuate up to 10 pounds a day, and I'm not exaggerating, some days more than that, when I used to live my Western lifestyle, and I hit over the 300s, 320, 340, 363, 280s, yo-yoing all the time, right? I used to live that lifestyle while training all the time, right? And I was unhealthy. I know that today. Call it a weight, call it what you want, but for the last 3 years, I have not fluctuated more than 10 pounds. Jean-Guy Bourguignon, Dimensional Wellness 365, right? We need to do for ourselves, for our family, for our loved one, for those we love and respect. We can get healthier without being taught or being told or being dragged into getting healthier. And if not for you, do for your children, do for your loved one, do for those you love and respect. Salut, merci, gracias and grazie. À votre santé.